Hello, and welcome to Growing Strong Roots, an occupational therapist's perspective on parenting, self regulation, and resilience. I'm your host, Leanne Bloom, owner and occupational therapist at Oak Bloom OT in Oakland, California. At Oak Bloom, we provide holistic occupational therapy for children, focusing on increasing functional life skills through interest based learning and family involvement. As a mom and a therapist working with families for many years, I've seen firsthand how overwhelming it can be to raise sturdy children. My goal is to share science-based strategies, real-life stories, and resources that can help you nourish those roots so that you and the children in your life can grow stronger, sturdier, and more resilient. Let's root down together, water those roots so individuals and families can bloom to their fullest potential. The goal is to give the child the tools to be able to express themselves and regulate before they act with an aggressive behavior such as hitting, spitting, kicking, biting, or throwing. Aggression and managing aggressive behavior from an occupational therapist perspective. As an occupational therapist, we see aggression not as defiance, but as a signal of an unmet sensory, emotional, or communication need. The goal is to give the child the tools to be able to express themselves and regulate before they act with an aggressive behavior such as hitting, spitting, kicking, biting, or throwing. When a child's having aggressive behavior, we need to dig a little deeper beyond the aggressive behavior and see what else might be hiding underneath the surface. What's causing the dysregulation? This could be from sensory overload or from this perspective of HALT, HALT. Are they hungry, angry, lonely, or tired? These are some of the questions that we can ask to find out the why behind the behavior. What's causing the dysregulation to the point that they're having aggressive behavior? Relationship is at the foundation for co-regulation, especially in an aggressive moment. There needs to be trust established between the child and the adult, and that comes from having time with the child to play and engage in interest-based activities with the child. When a child's displaying aggressive behavior, it's super important for an adult to stay grounded and regulated as a calm presence. If an adult is having a hard time doing that, and it's difficult to do that because emotions are contagious, I would recommend to communicate that they're going to take a minute for themselves to the child and go and take that minute. Take a few deep breaths and come back in a regulated state. You and the child can start to co-regulate by staying calm, using an even tone of voice, communicate safe body language, and just maintain some deep breathing while you're at it. You can start to help the child co-regulate into a more calm state by doing that. And as such, we can manage that aggressive behavior since it can be so difficult to deal with as an adult. There are other prevention strategies that I want to mention here as it relates to sensory. Engaging in a sensory diet can create opportunities for movement and calm. Taking breaks throughout their day, such as jumping, stretching, climbing. These can be activities of movement, but also there's more calming input, such as just reading a book or having some time to oneself to recuperate from the busy, sensory-rich world that we live in. By providing a safe place for children to have dysregulating moments, such as a room or calming space, or even a crib. There are some children, even very at a young age, can have maladaptive, aggressive behavior, and we really want to create an environment that they can be safe in. That may mean putting up pool noodles around hard surfaces or padding on the walls of a crib so that they can just have a place to physically move through their anger and frustration. One of my go-to strategies is deep pressure. That's deep proprioceptive input, which can be a big hug or a weighted blanket or pillow. You could do burrito wraps where you take 4-way stretch lycra fabric and you wrap the child up like a burrito, using a bit of play there while you're at it. or a body sock where they can get into this four-way stretch fabric and really move their bodies with resistance. You want to provide structure and predictability, especially during transitions. You can use visual schedules, timers, or first then language, such as first we're going to clean up and then we'll play outside. Or first we're going to line up and then we're going to go sit down at our desks. You can include the tools that they may have access to in those moments too, such as water or other movement strategies. Additionally, you want to teach them emotional awareness. Keeping in check with having regular emotional check-ins can be super helpful to decrease aggression by being able to have the words and the body awareness to express themselves. They can notice what they're feeling and start to feel so they can notice when they're starting to feel dysregulated and upset, and further check in and be able to use a tool to prevent those aggressive behaviors from happening in the first place. So after the aggressive behavior has occurred, we want to repair, reflect, and reset. And that may take some time between when the behavior happened and when you want to talk it through. You can walk them through with what they could do next time, playing it out differently, using a tool. What tool would they use next time? Role play it out with them. Suggest alternative endings to these frustrating situations, such as stomping their feet, squeezing their ears, or saying stop, or screaming into a pillow. Sometimes the aggression just needs to get out of the body. If there's repair that's needed after an aggressive act, there may require some adult guidance to apologize, make amends, or reconnect with the person or people they've offended. They can listen to the other person's experience and reflect that back to them. They can really lean in with curiosity and questions if they don't understand why a person was upset or what caused them to be upset. They need to understand for themselves why people might be upset so they can apologize with heart. Just telling a child to apologize can feel empty to the other person receiving the apology. The child needs to understand their role in upsetting another person. Further, behavior has consequences. Now, I'm going to get into this in a different episode just on consequences, but it bears mentioning here as we want to have some consequences for maladaptive behavior. Setting the consequences up ahead of time and having expectations ahead of time is utmost importance. Natural consequences for those actions whenever possible. A child may need to calm down first to understand the behavior and thus the consequences of their behavior. I'll follow up with another podcast just on consequences and how to manage those. Thanks for listening. I hope this helps.